give you the brief about how the course is going to be. So first of all, welcome to all of you in ECMO India 25. There is the 23rd National Training Course and 11th ELSO Endorsed Course, comprehensive course based on. Uh, basically a hybrid course, as all of you know. What I'm going to talk in next 15 minutes is about the society, about how the course we are going to conduct, and about this particular course on June. So, talking about a society, we have established ECMO Society of India in 2010, and we are conducting this training course since almost 15 years, as you know, the 23rd training course. We got our course also endorsed in June 2022, and from that time till now, this is the 11th training also endorsed course. The society has started with the institutional membership, which is free, and you can be a part of the society as an institution also. And you can, we have a facility to upload the data, so you can put your data on the ESY, so we can get in Indian data. We have society started with the state branches, and now at present we have almost 12 state branches, that is Delhi, Gujarat, Maharashtra, Bihar, Kerala, Telangana, Rajasthan, Karnataka, Jharkhand, Tamil Nadu, and UP. We are running two courses, fellowship and certificate courses, and that are running twice a year. One batch is January batch, and second is June batch. And we have established a chapter along with an ELSO known as Southwest Asia and Africa ELSO chapter, SWAC ELSO, and it was done in 2013. So when society started, it started with the aim of spreading the science, creating awareness, training medical and paramedical staff. And then the next goal is started making a standard protocols and guidelines and have a common data registry of ECMO cases in India. And that is what we are working on now. And the immediate next, which we are already working on, is to become a self-dependent in the field of ECMO. So as all of you know, ECMO is a complex, high-risk procedure. It requires teamwork. It is unpredictable when you get an ECMO patient and from where you will get ECMO patient and where you have to start ECMO. That's going to be unpredictable. It involves huge cost, and so there's a lot of finances which is involved. And for all that, you require to have a good structured program, and that should have proper guidelines and standards in it. So ECMO program should have a team support for 24 hours a day and 365 days in a year and 360 days in a leap year. You should have facilities and equipment. Location, as I told you, it can be interchangeable and you have to be flexible. You might have to start ECMO in ICU, might have to start ECMO in OR, might have to start ECMO in emergency room or casualty, might have to start ECMO in wards. So it can be interchangeable and you have to be flexible for that. And for all that requires a good policies, procedures, and a very good communications. As all of you know, ECMO cases are not that common. They are the cases are very less, and so people who have seen thousands of patients on ECMO is going to be very less. There are few people who have seen that. So for that, you should have good connection so that you can, whenever you have a problems, you can have a discussion with your seniors, colleagues, nationally and internationally, so that you can see and troubleshoot it very well. And it's a huge team that you should have it, right from the medical director to consultants, coordinators, the specialist, ECMO specialist, nursing staff, fellows, perfusionists, and uh, member from each and every multidisciplinary team. So that all things are very essential be a part of ECMO team. Now, when you join with this course of ELSO endorsed course, definitely you want to become ECMO specialist. And then what are the basic characters you should have it is the most important one is you should have be dedicated to critical care and to the ECMO. You should be a team player, so you should be able to work in the team. You should be passionate about the science and technology. You should be able to give 24 hours support and you should be flexible and committed to your work. So these are the basic qualities that you require to become an ECMO specialist. Now coming to this course, we designed this course that based on how the learning skills develops, and this is a well-known phenomena where the lectures and reading just gives you 5 to 10% of what you can remember. And that's why we have kept the lectures between 5 to 7, and that is didactic lectures, what we have kept it. And from 7 to 11, you can go through the PDF talks, which I've already said yesterday, most of it, and some of them remaining, which I'll be sharing as the talk goes on. So you can go through these talks and you can read that, and that will give you some 10% of knowledge. When you come here, and even the videos of this all recorded talks is going to be shared, so you can see that. When you come here, there'll be a demonstrations, there'll be a case discussion, there'll be a study group, so there'll be a case discussion. That gives you some knowledge about 30 to 50%. And then all 3 days we have a simulation session. So in that you have to observe, diagnose, and you have to perform by yourself. And that probably gives you a 75% of knowledge. And that's the way we have designed this course so that you get the maximum out of it. Obviously, when you teach others, you get the most. So we are the one who, every time when we teach, we learn more and more. It's not only important to listen to the talk and everything, but you should constantly think about it. And that's why the reflection is very important. So whatever been done, yesterday's talk, today's talk, tomorrow you should come and think about, ask about the questions of what has happened yesterday, whether you gain something, whether you learn something new. So that has to be thought of, and that the questions should come and you should ask the questions. That will help you to get trained. Okay. As you know, this is a comprehensive educational course. It is an ELSO endorsed course. And once you do this ELSO endorsed course, ELSO is doing one ELSO Adult ECMO Practitioner Certification, EAC certificates, and that that is valid for 3 years, and that gives you about the certificates that you can practice ECMO. Obviously, it does not have much of a legal validity, but that is a certificate which is the highest body which is giving you. So during these steps, you can follow exam both step 1 and step 2, and you can directly go for and give the exams, online exams, and you can get these certificates. There are very few centers all over the world who are running ELSO endorsed courses. 16 to 20 centers are running ELSO endorsed courses. And if you see, our course is the most economic course across the world, and that is almost around 20 to 25% of the course fees. So you can understand how cheap this course is. You can get all details about ESC exams. If you are interested, you can go to the ELSO website and on this link, and you can get this. This is going to give you a theoretical knowledge of ECMO, when, why, and how. Practical skills about the components, circuit management, and water drill. And it's not only that, but it also helps you to, this course is going to help you to develop thinking and communicative and behavioral skills with the help of simulation. That is what the most important part is. So you should have observational and clinical skills through the different scenarios. This is what the distributions of delegates who are coming for this course. Almost we are getting the delegates coming from 16 states of India and 2 countries, Russia and UAE, and 16 states of India. We are getting this. Majority are coming from Maharashtra, Telangana, Tamil Nadu. From there, the majority of the people are coming. If you see the specialty wise of the delegates, most of them are 70% is intensivist, 8% is paramedicals, and then cardiac anesthetist, and followed by a cardiac surgeon, cardiologist, and pulmonologist. So most of the talks will be finishing virtually. Almost 95% of talks will finish virtually. 2 talks of mine I'll be keeping for on a second day of your practical sessions, because that will be more of a revision talk. Water drip component will be taken care on 12th and 13th of June. This dates 12th and 13th of June, and simulation will be on 12th, from 12th to 14th June. Exam of pre and post course test will be there. I think most of you already appeared. Post course will also be there. and there'll be both theory as well as practical post-course test. And clinical preceptorships, those who are interested to see live cases, it is an optional for you. You can register your name for that. So altogether, there will be 33 lectures, 18 hours of practical training, and this is how the course is getting distributed. Most of the time, see, the didactic lectures is only be 11 hours, and then 18 hours is a long time where we are going to give you only practical training. So this is more of a practical oriented program rather than a didactic talks. When you come here for practical sessions, there will be 8 sessions, then 3 days, and that will be hands-on. We'll divide you into 8 groups, and then each group has got 10 members. And preferably, we like to keep a mixed group of intensivists, anesthetists, pediatric intensivists, whatever is there, so that in that case, whenever you get to see a scenarios, you will be able to perform best because all the field people will be there in the groups. When talking about our simulation program, simulation is more like a realisms, and that is purely made in India. So we made our own mannequin, and we have made our own ECMO mannequin for developing a simulation. It is going to be more of a realistic scenarios, multidisciplinary team training. So you will have a pump, team, ventilator, patient, monitors, everything will be there. It is just not an electronic simulation, but very close to the real life scenarios. And when you come here, you will realize that. And that will be done on 12th during workstations. On 13th, half of the day is going to be only on scenarios, and 14th, the full day is going to be on scenarios, where we are going to cover almost more than 20 scenarios in this course. Okay. And you have to just observe, diagnose, and treat as if you are treating the real patients. Okay. And one team will come to the simulation room to perform it, but rest of the teams will be able to observe it from on a multi screen, so that everybody will be able to get to see these 20 scenarios. About the post-course test, that is going to be again the same how we have done. So there'll be MCQs of 40 marks that will be online. After you finish with the practical with your exams, they'll be online. After we finish the practical sessions, there'll be a 40 marks online exams, the way you have given a pre-post test. And there'll be a practical water drill for individual people. On 6th of June, there'll be a simulation scenarios, and that will be considered as one of your part of practical exams. So it will be assessed as a team. So one team is called, which will be comprised of say around 7 people, 6 to 7 people, and they have to perform on the case, and you will be judged on that basis. Clinical preceptorships, it's an optional. Ideally, you should attend for 40 hours to get proper knowledge of it. Preferably, you to see both respiratory as well as cardiac cases. Those who are interested for clinical preceptorship, want to see live cases, they can give their name to our office staff and which city you are, so that whenever we have patients in that particular area, we can call you and inform you, and you can come and see the patients. As I said, we are running 2 programs, fellowship program as well as certificate course programs. The June batch is just now registered, and we have started with the June batch. The next batch is going to come in January, and the entrance exams will be there on 25th of December. And once you clear the entrance exams, you will be able to join the course. Fellowship course is for 1 year, that is basically for postgraduates, and certificate course is for 6 months, and that is basically for undergraduates and paramedicals. The objectives of the course, and it's going to be regular as well as alternate course. We have almost 45 affiliated institutes all over the country. And as I told you, there'll be entrance and exit exams, both of them. You can get all the details on our website, www.esicourses.com, or you can write us the email to us. And this is general instructions. Attendance is compulsory. Keep your audio mute so that people can say. You can put your question in the chat box, or you can raise hand during the question answer sessions. We'll start things on time so that we can finish on time. And certificate you get at the end of the course after completion of exams and filling up the evaluation form. If you don't appear for the pre and post course exams, or if you have not attended fill up the evaluation form, you will not get the certificates. So that's it. Any questions?